Hi everyone. Today I would like to share with you some of my work on an exciting area of computing, intelligent mobile systems, and how we can design them to positively impact society. I create new computational and sensing techniques that has led to work across a variety of domains, spanning underwater systems and smart RF surfaces, the Internet of Plastic Things, smart fabrics, and even augmented audio for intelligent earables. But there's one domain where it had the most amount of practical impact, and that is equitable healthcare. The goal of my research here is really to create technologies where we can ensure that every human being on the planet will have access to basic medical diagnostic tools at their fingertips. And to give you a flavor of my research, I want to talk about the field of audiology, which is focused on diagnosing disorders of the ear. As an example, ear infections are one of the most common pediatric health conditions, and it typically requires visiting a doctor or specialist's office. But not every parent can afford to take time off from work or have health insurance to help foot the medical bills. We created a smartphone-based wireless sensing system that uses a paper cone, and you can send audible sounds in and out of the ear to detect ear infections. And the idea here is that when there's an infection, most of the audible signal will be reflected back, and we can run classification algorithms to detect infection status in real time. We've evaluated our system across 2 hospitals and obtained comparable performance to specialist tools, but the key benefit here is that our tool can be used by parents and tested in a home setting. The device is being commercialized, and it is FDA listed and available at select clinical facilities. The second part of the ear I've looked at is the inner ear, which has the cochlea, which is this curled-shaped purple organ. Normally, when you hear a sound, the sound will travel all the way in towards the end of the cochlea. And this will cause the tiny hair cells, as you can see on the right, to start vibrating energetically. And while we normally think of the ear as a microphone that will absorb and process sounds, these tiny minute motions will emit sounds of its own like a speaker. And these sounds are so soft that often humans can't even hear them. But we can leverage a very sensitive device to detect these faint sounds and use it to perform newborn hearing screening. We've designed 2 low-cost systems for this. The first uses cheap $2 or $3 earphones, the kind you would normally get on a flight and throw away, but we can connect it to a cheap budget smartphone where we can run these algorithms and detect the weak sounds from the ear. The second system is a pair of $30 wireless earbuds that can stream the data over Bluetooth to a smartphone. We've tested our system in a clinical study over 201 ears at 3 clinics. And this is exciting because it's led to an international group called TUNE with doctors and government agencies in Kenya with the goal of bringing newborn hearing screening to every hospital in the country. Beyond the ear, there are many more opportunities in this space. Here is an example of a blood clot testing system that uses the vibration motor to vibrate a sample of blood or plasma and move around this tiny copper particle. And using the smartphone camera, we can analyze the motion patterns of this particle and use it to track exactly when the blood has clotted. We can also design future healthcare systems, such as this that develops real-time machine learning systems for smart speakers like Amazon Alexas, to detect distinct gasping patterns associated with cardiac arrests. And these systems are important given that most cardiac arrest victims often die alone with no chance of survival. We've been working more broadly to detect audible biomarkers and have this technology to scale out to millions of different devices. We live in a really unique and exciting time for the future of healthcare. And one of the most exciting aspects about this research is how innovations in computing that can advance healthcare for just a single condition can have profound impact on millions of people. Thank you very much.